Hello everyone, my name is Alberto Imbrogno, and this is the video requested for the application, as part of the application for the Master of Clinical Psychology with the Cairn Institute. The question that this video is based on is basically describe a moment of feedback that you received and how that changed your practice and your work as a psychologist. The example that I came up with is an example from private practice while I was working. It was about 2 months into working as a registered psychologist. Back then, I volunteered. I know that I didn't need supervision, but I volunteered to be supervised back then. And my supervisor was observing my sessions with one client. This particular client was suffering from anxiety, depression, some substance abuse in the past, some emotional dysregulation. So the feedback that I received from the supervisor was that although my case notes, sorry, my case notes and my session with the client, my psychoeducation with the client was very thorough. She told me that it was probably a little bit too overstructured. As in, I was providing too much psychoeducation. I was almost talking over. Sorry, I was talking over the client, the patient. I was providing, education in terms of how the brain works, how the brain develops, the impacts and the effects of the chemicals and the drugs on the brain. So my neuroscientific and psychological background was too much, right? So that was the feedback. So with the help of the supervisor, we worked on becoming more person-centered. So meaning more Socratic questioning, more listening, more stepping back and allowing the client to express themselves. We worked during supervision. We also worked a little bit on, why I was keen to educate the client, why I was leaning toward structured scientific psychoeducation and less toward person-centered and warm and narrative and listening. We worked also on that, but the main feedback was that one. So from there, I started to basically step back, listening, active listening, paraphrasing, reflecting back, proposing, ideas, I guess, in terms of listening and say, hey, this is what I learned of that. So this is my understanding. Am I hearing correctly? So listening, paraphrasing. Also, the other thing actually was also focusing on the client's body. So a lot of somatic work in a sense. Where is your anxiety? How do you feel in your body? Have you tried this exercise? Paced breathing, cold water, DBT, ACT. So but it was mainly Socratic questioning, person-centered, listening, active listening, and somatic work. So it's almost like I complemented my neuroscientific knowledge with a more person-centered, Socratic, I guess, active listening approach. So that sort of feedback was absolutely, I guess, pivotal, because the outcome that I got from the clients, from the patient in general, was that the patients were feeling heard. First of all, heard. Second of all, also they started to deep into their own knowledge and their own values. Even another example was simply to focus on what they value most in life, how their personality, I guess, their values can affect the decisions in the present day. So really focusing on the client more than on the knowledge that I had. Like, I may know a lot of different things, but if I don't have people skill and communication skills, I may not go anywhere, right? So, and once you see the client growing and feeling empowered, so that was a very valuable feedback, I suppose. That's the best one that I can come up with for this video. I did apply for this Master of Clinical Psych because I really love what I'm doing. I'm really trying to help people in general, trying to let them grow and change and improve their lifestyles. And if they can simply improve just a little bit, is a big goal for me. So I really hope that this course will help me to improve myself and improve my clinical skills as a psychologist, and really help more. And I land here saying that it's feedback is always important. Like I'm always open to feedback, particularly working on transferring content transfers. That's something that I've noticed. It really helped me a lot. Very psychodynamic in a way. So yeah, I'm very open to feedback. I think feedback is very important in this practice, particularly as a practice as a psychologist. So I can't wait. I'm very curious to know more and to do more and to do better, to help more people basically. Be unbiased and more objective as a psychologist. That's all. Thank you.